This show is for informational purposes only. In view of the complex nature of health and disease, it is only recommended that you change your current treatments or healthcare practice with the direct assistance of a health professional. You can contact Dr. Dale if you desire to achieve true health. Call his office at 931-591-2010.
First, understand how the FDA used to work. They take data and research developed and constructed by the pharmaceutical industry, by the pharmaceutical companies. They take that information and they review it. The FDA reviews the fox's reports on whether the fox kills chickens. Like, do you get this? They're nothing more than a review board, for which they take the drug company's information, for which how many times have the drug companies lied in the past? I always laugh about that. And like this time, it's like, hey, so you're not going to lie to us? Okay, you said you're not going to lie to us this time? Okay, great. Oh, you said your drug's safe? You say it's effective? Perfect. Stamp, rubber stamp, there you go. And that's what the FDA has now become. They become nothing more than a rubber stamp organization to allow for drug companies to monopolize the healthcare industry. Because even though chiropractic care, give you an example, even though chiropractic care has been proven effective in lowering blood pressure, better than any two medications on the market, the most effective medical procedure anywhere, anything, all right? On par with wild garlic. Wild garlic's amazing too. So there's your wilderness remedy. But get this. So you combine chiropractic care and you combine wild garlic, we can lower blood pressure safely and effectively, better than any combination of medications. But I cannot market it as a chiropractor to the general public. I cannot say, I will treat your blood pressure, I will treat you for blood pressure. I can't do that. I can explain the science. I can explain the University of Chicago's medical center, hypertension center, and explain and talk about that research, but I can't market it. I can't make commercials about it. I can't make beautiful butterflies and people frolicking through the trees and saying, my blood pressure's low because of chiropractic care. But the pharmaceutical industry can do that with their drugs. Guys, do you get that? The FDA is nothing more than a shield to withstand natural wilderness remedies, natural cures, ways to enhance and improve a person's life and health, to treat conditions through their underlying causes. See, one of the underlying causes of blood pressure is spinal injury, misalignments, degenerative disc disease. These things cause stress and tension on the nerves that go to the heart. If you place stress and tension through degenerating the spine or misaligning it, shifting it out of alignment, when there's pressure on the nerves that go to your heart, there's stress there. And if there's stress there, then the blood pressure is going to go up. So we have to take that stress and pressure off those nerves. And this is also why. So here I go, going over to, and Ashley, remember to place this on there, beta blockers. The number one selling medication for blood pressure. The largest study ever conducted showed no reduction in stroke or heart attack. The drug was basically found to be completely worthless. Worthless, folks. Not enabling people to receive the benefits they desired, which was not dying. Didn't do it. Nothing. Lowered numbers. And that's sadly what the pharmaceutical industry is all about. They're about treating symptoms. That's the way our medical profession right now is functioning in the majority of the system. Treating symptoms, allowing the disease process and the condition to worsen, putting pieces of duct tape on everything, allowing people to get worse, need more and more medications, and then all of a sudden they die. Maybe from the drugs, maybe from the condition that was never treated properly. See, if the spine is out of alignment, or you have severe inflammation from a poor diet, those are the primary factors that cause blood pressure issues. So what we do in my clinic is we address the underlying cause. We look at the foundation of your health, which is your nervous system, because your brain and your nervous system control every single function in the human body, from your heart rate, your blood pressure, your breath, your digestion, every single function of the body is controlled by the nervous system. So if the spine is out of alignment, it's like a circuit breaker, all right? A circuit board. If the spine shifts, it's like altering that circuit, shutting it down or lessening, distorting that signal, causing stress. So if there's stress there because of germ disease, because of neck pain, because of the round hump on many females can see that, even some men, when they get that kind of shelf on the back of their shoulders, they get the roundness there. That's an indication that there's a severe misalignment in that area of the spine. Those nerves go to the heart. No wonder Archives of Internal Medicine from 2006 states that a man is shrink 3 centimeters or more from posture distortion as well as spinal deterioration, they have a 64% greater mortality risk, death from all causes, and a doubling of their heart disease risk. Guys, that's huge. That's how important your spinal alignment is for your health. So what I do is I address the factors, the causes of blood pressure. I can do that in my clinic, but I cannot treat blood pressure. Kind of one of those, huh? You know what I mean? Like you have to do it. Don't treat. I'm just saying, so the FDA doesn't come and shut me down for treating blood pressure. I never treat blood pressure. I treat patients. I help them with their nutrition, and I help them correct their spine and lower stress. And through that process, guess what? As stress decreases, as inflammation and plaquing and hardening of the arteries through improper diets decrease, or eating sulfuric foods like garlic, sulfur-containing foods like garlic, things that help decalcify the arteries and soften them up, make them more pliable to be able to regulate blood pressure better, guess what? The blood pressure starts to come down, the body increases in health. That person, as we increase health and lower stress, will live longer, will have a better quality of life, will save money on their health insurance, will save money on their drugs. Get that. It's amazing what can happen when you correct the underlying cause. If anyone is out there listening right now and they desire to correct the underlying cause, please give my office a call, 931-591-2010. Again, I'm the Wild Doc, Dr. Dale. My clinic, call that. Go to the website, thewilddoc.com. Subscribe there. You can get clinic information there as well at thewilddoc.com. You can listen to the reruns of all these shows. While I went from talking about this flu vaccines and autism to blood pressure and all these things, but what I'm trying to do here, folks, is we have to realize where our healthcare system is currently and what we need to do about it. All right, I got to give one more story here about this idea, just to kind of sum it up, wrap it up really well. All right, I've got an article from 2012. Talks about Davy Jones, singer from the Monkees. I was getting on a plane at that moment in time. I was getting on a plane headed to the London Olympics in 2012, and I remember that very specifically. This is back when I was part of an organization that we helped take care of USA Wrestling, and I was going over to do that. All right, so I'm headed over to London Olympics, and I'm getting on a plane, and I always like to read research or new articles in terms of health. So I get on like CNN, New York Times, Washington Post, LA Times, different media outlets, and I get on there and I find what's the talk about right now in our medical and healthcare system. Let me talk about that so I can educate my patients better or protect them in case the mainstream media is not going to come out and publish the truth, such as this article right here where the flu vaccine increases the risk of autism. So, anyways, Davy Jones, a singer from the Monkees, dies of a massive heart attack at 66 years of age. All right, when I started reading that article, I know nothing about singers. My wife will attest to that. Nothing about music. I can't even hold a tune. I know the song Jesus Loves You. That's about the only song I can sing all the way through, probably. Anyways, so I'm sitting there, and I'm reading this article in the airport, and for a second, I thought to myself, why am I reading this? Who cares? And I almost stopped reading. But I didn't. The sentence after that thought was he was a vegetarian. There was not an ounce of fat on him. He lived on the beach in Florida and ran miles every single morning. This is the last person I expected this to happen to. And that was the quote from one of his friends. In that moment, I said, God, thank you. I wasn't thanking him for Davy Jones' death. I was like, I'm sorry, Lord, I didn't reach Davy Jones. But I said, Lord, if that is true, if he's living that perfect lifestyle, he's living the lifestyle that should significantly lower someone's risk of heart attack and stroke. I said, there's only one reason this man died. It has to be his spine. And I literally, I thought about doing it right there in the seats at the airport, getting on my knees and saying a prayer. But I said I didn't do that. Thankfully, it was enough. My prayer was, I said, God, somewhere in this article, you're going to give me the answer to why this man died. You're going to allow me to connect it to his spine. I said that. I literally commanded the Lord to give me something. And he did. I kept reading on. Literally, in the last 3 or 4 sentences of that article, it said, he told Britain's Daily Mail last year, I used to be 5 foot 4 inches tall, but I've lost an inch. I've lost an inch. How do you lose height, folks? How do you lose height? You lose it in the deterioration of the discs of your spine. Degenerative disc disease has been shown to basically be a terminal illness. Why? Not that degenerative disc disease is going to spread through you. What it is that is a sign that the spine, the protective housing, the structure that enables your brain to communicate through the pathway, your spinal cord and your nerves, properly. So without that protection of that structure, without the proper alignment, from the deterioration, you accumulate more and more stress and pressure on the nervous system. Through that process, more and more stress increases on the organ systems of your body, and through that process, they wear out and they fail far sooner. I literally said, thank you, Lord. This is what I need to reach thousands of more people with a truth that the foundation of your health is your nervous system. From there, give it the right raw materials, the nutrition that it needs to be able to build healthy cells and tissues. It's got to have the right raw materials, and it's got to have the right coordination to be able to use those raw materials to build health. That's the foundation of what I do in my clinic right there. Again, if you want to get to the cause, call my office, 931-591-2010. If you want to build resiliency and health rather than dependency on drugs, my clinic is the place to be. I'm telling you right now. All right, so let's go through this article. I wanted to go into more in depth because of the naysayers and the trolls out there through the media outlets, and we just got to make sure that they understand. I've read the entire study. It's all the way highlighted. Ironically, I had a medical physician. I treat medical physicians in my office. I really do. I'm not allowed to say their names, and they don't want me to either because they're like, I just don't want to know. I'm like, I actually sneak them in the back door. Uh-oh. They come around the back side so no one sees them coming in my clinic. I'm just kidding, folks. But soon enough, it'll probably get there. They know I can help them. One of these guys he was a PA working at Fort Campbell. He was set to undergo spinal surgery, and he helps with spinal surgery. So he helps with spinal fusions. He had the opportunity to stay in the military. His opportunity was get this surgery, and that's your last chance. He went through chiropractic care, but not structural correction chiropractic care like I provide out there at Fort Campbell, and it wasn't able to benefit him. He went through this injections and different things like that. Still didn't benefit him because nothing was correcting the structure of his spine, correcting the cause. So he's 18 years in. That's like, he's right at that mark where it's like 2 more years, just a little bit further. I get, it's not a golden paycheck, but it's that great opportunity for better retirement through the military. So he's right there. And he has to be med boarded out because of back pain. So severe that at times his legs would completely give out from underneath him. He'd hit the floor. He's telling me about a time when he was walking down the steps, and literally he's walking the last couple of steps, his legs just completely, it's like the nerve, he's like, it literally, it wasn't pain, it was just my legs wouldn't work, and he fell. He had such significant pressure on those nerves. And at that moment, he said his daughter, his little girl, I forget how old she was, 10 years old, had to help him up. And this guy's like 7 feet tall. And he's like, I was so embarrassed. It was so hard for me to take that type of, emotional pain, to think I'm going to have my daughter help me, and she's this young, And he literally cried in my office that day. I remember that. Just, reliving what he'd been through. He was so frustrated, though, after 2 weeks of care. Not with me, but with the fact that this type of care is not better provided, not paid for.
The only option they gave him was to have surgery.
Yes. Yep. And he refused. That's the moral of the story. This guy who watches those fusions, he said they fail all the time. I would never do it. I never suggest anybody do it. He says 8 out of 10 people, they're always worse off. But yet we keep doing that. And why do we keep doing that, folks? Why does the insurance still pay for that? Because of lobbying efforts by the NASS, National Association of Spinal Surgeons, Association of Spinal Surgeons, lobbied to our government, had to do it twice now, to prevent the shutdown of spinal fusions for the purposes of degenerative disc disease, herniation, sciatica, radiating pain, all the things that they do it for, other than like breaks and fractures, okay, broken backs, okay? That's a time and place that it could benefit. So he refuses it. Speaks volumes, folks. If you know somebody who is literally thinking about back surgery, is in back pain, they have to try. They have to go through structural correction, because the alignment of the spine is the primary cause of back pain, degenerative illness, degenerative disc disease, degenerative spine disease, degenerative arthritis, joint disease, anything you want to call it. Spondylosis, if you actually knew the technical term and your doctor gave you that and you're like, I don't have any of those, I have spondylosis. That's what the doctor said. Well, then spondylosis is arthritis, so come on in. Let's get you fixed up and well. But he was frustrated. This man was so frustrated because 18 years in, practically, med boarded out, now can't provide financially for his family anymore with what they would give him for med boarding him out. He's got to go back to work, find a different job, which thankfully as a PA he's able to find great opportunities for work, and he has been. And I have to say, this man right here is a true man of God, because he took this article right here. He's gotten well, no more pain, doing phenomenal. He gets to share with me the Lord's blessings that have blessed him in his life and his family and stuff since he's been able to get out of pain and get well in his life, and no medications. I mean, he's doing amazing, folks. Amazing. That's what people desire. That's what I want for my community, my community members. That's what I want for all the medical physicians. A happy, healthy life without medication, without disease, without dependency. I want people to be able to live that life. How do we get that? Sadly, TRICARE doesn't pay. He did recently, so he had to go through all that treatment long time ago, went through all the treatment plans. You know what? I keep it very simple. It's $45 per visit for our military members, and it even goes down after that. I give them discounts for our veterans, military, for active duty, for their families, all those things, okay? But he had to pay out of pocket back then. Now he's gotten Tri-West to approve 6 visits. And I always laugh, 6 visits, really. This guy needs ongoing care. He's going to go through a $100,000 to $150,000 surgery. Why don't they just give me the $150,000 that they would have gave for that surgery, for which what we should pay is results? I got the results. I'm not gloating on me. What I'm doing is, any chiropractor that could do this should get the same amount of money that the surgeon would get for a less effective treatment. We should get that if we're talking about value, folks. Value. What's the value to this man's life? Well, the surgery had a value of $150,000. Why wouldn't chiropractic care have that value? The value is far exceeding $150,000 for him not to be literally more pain, more opiates, more narcotics, potentially addicted, losing his family, losing his relationship, going to jail. That's what's happening right now for thousands of people in America right now because of the opiate epidemic. And spinal fusion surgery, for the most part, adds to that. 70% of the time they're worse off. 48% increases in opioid need and necessity, according to the Journal of Spine from the year 2011. 2011 Journal of Spine says that for work-related disability, lower back pain, if somebody undergoes spinal fusion, they have a 48% increase in opioid use. They're worse off than doing nothing, folks. It stinks to have to wait it out till your body can somehow compensate for it and get out of pain, but your body would do a better job at it than a spinal surgeon can. That's a fact, folks. 2 government committees. Here's why I get so upset. Here's why I get frustrated. Because corruption should never be able to be tolerated. Yet it is in this nation. People don't like it. Many people just ignore it, though. They just don't know about it. So that's why I'm bringing it about. God has placed it on my heart to bring about the knowledge and information to show the world, to show our community the corruption of the pharmaceutical industry. And a subset of the medical physicians, medical doctors, medical system. Okay, we got to bring this out, and then we got to drain the swamp so the mosquitoes die. These blood-sucking people that suck us dry in terms of our economy. We spend 1/5 gross domestic product on healthcare, and I've been saying that stat, and that stat's from years ago. So it's probably more than that right now because healthcare spending has only gone up. We've got to do something about this. People are dying because of the lies of pharmaceutical companies. And sadly, I get so frustrated because I think to myself, I've got to be that much more pissed off with this situation because I see a lot of people don't get pissed off about it and do anything about it. And some people just don't know what to do, and that's what I want to encourage. So on our website, on thewilddoc.com, in the near future, whenever we can get this program set up, we'll give you an opportunity to direct mail whenever we talk about politics and drug companies, and you want to do something about it through our website, thewilddoc.com. You will be able to email or call your Congress members so you can let them know what you desire in terms of our healthcare system. Because right now they're letting a lobbying and pharmaceutical industries steer and drive the laws they pass, like the 21st Century Cures Act, which is completely a handout to the pharmaceutical industry. Completely erodes the FDA's ability to protect the American people. All right, where am I supposed to go with all this? All right, so association between influenza infection and vaccination during pregnancy and risk of autism. This is the section we're going through. The Journal of Pediatrics published November 28th, 2016. I get this hot off the presses. How I got off on that tangent. I figured it out. The gentleman I was just talking about with the pain, and I got him well. He didn't have surgery. He's got a great life with his family and friends now. He asked me for a copy of this because he's a medical physician. And he's like, I don't have a subscription to the General American Medical Association, so I can't get the full PDF. Can I see it? He's like, holy cow, you highlighted it? I'm like, yeah, I want you to know the facts. I want you to be able to read through it quickly. I want you to be able to apply this to your clinical practice so that you can protect patients. I'm like, bare minimum, at least use common sense. If the indication of this study was that during pregnancy, if a woman was vaccinated with the flu vaccine, there was a significant risk of autism in that child. Okay, significant risk. If that was the fact at first trimester, they said it wasn't as significant in the second and third, for which they then did analysis to say that, it's not significant enough to say that there was an indication, but it wasn't significant in the second and third trimester, according to the research. But there was during the first trimester. So at least use common sense, folks. At least medical physicians, hospitals, places giving out these flu vaccines, at least say, from this research, we have to play it safe, and we're not going to vaccinate pregnant women during the first trimester. And I oftentimes will ask patients, they'll be like, hey doc, I've got this going on with my health. I got a thyroid issue. All right. I just had a patient here last week come to me say that she's gone to functional medicine doctors, but her problem was not coming from the poor nutrition. But that's what they're doing, and they're doing supplements and medications and natural healthy medications, things like that. So they're doing a better job through this functional medicine clinic, but they were not addressing the spine, the foundation of somebody's health in life, through the communication of their nervous system. So they weren't addressing that. She comes to me over a year ago, and I say, by next year, I believe you'll be free of medication. That's your goal. I'm going to get you there. All right? So we found in her neck that she had significant misalignments to the region of her spine where the nerves branch and go to the thyroid. So why would the brain and nervous system not be controlling the thyroid properly? Right there, because there's pressure on those nerves, inhibiting the proper signals that go to that organ, stressing that organ out, and then causing inflammation, and inflammation causes inflammatory cytokines to occur, and then an autoimmune type reaction ensued, and she had Hashimoto's. So with this patient right here, and there's multiple contributing factors to this, I'm not saying every single Hashimoto's patient that comes to me gets off, but I've seen every single Hashimoto's patient that's come to me get better with just chiropractic care at least. And then nutritional protocols for some have to go very in depth, and some less than others. Person to person, it all makes a huge difference. Her thyroid antibodies are way down, almost completely to where she's no longer considered Hashimoto's. They're low enough to say that. Her thyroid numbers are perfect, all within normal ranges. She's feeling amazing, and she's getting off her thyroid meds. She's down to a half, and now she's weaning off completely in the next couple months. Amazing. We can do that through restoration of normal function of the body, through nutrition, those things. Keep an eye on Facebook in case we have any Facebook followers and listeners wanting to ask any questions or comment. Feel free to comment. And then go ahead and pull up the Facebook on that. So, kind of review this section again. Always enjoy callers. Again, if you want to call my clinic, 931-591-2010. If you want to call the radio station here, you can always like us on Facebook, Wild Doc Facebook page, and then listen to these videos, watch these videos, ask your questions there. But again, Journal American Medical Association Pediatric Edition, November 28th, 2016, Association between Influenza Infection and Vaccination During Pregnancy and Risk of Autism Spectrum Disorders. They found in their conclusions, here are their conclusions. There was no association between maternal influenza infection, so no association between flu infection, that's what influenza means, anytime during pregnancy and the risk of autism. There was suggested increased risk of autism in children whose mothers received the influenza or flu vaccine during their first trimester. But the association was not statistically significant after adjusting for multiple comparisons, indicating that the findings could be due to chance. These findings do not call for changes in vaccine policy or practice, but do suggest the need for additional studies on maternal influenza vaccination and autism. See, here's the thing: is this big old this person says, "Oh, you didn't read it completely. They found out that it had to do with other factors that caused the increased risk of autism." No, they didn't, folks. No, they didn't. Do you understand that they did a post hoc? Get this. We conducted a post hoc analysis to adjust for multiple comparisons. Because they were comparing multiple factors, they decided, here, listen to all this. Post hoc, what's that mean? Here's how you break this down, folks. Here's how you know. And then just say this. Their analysis said it could be due to chance. So if it could be due to chance, then it could be due to the vaccine causing brain damage, for which there's a physiological and biological mechanism by which they know that flu vaccines can cause brain damage and neurological conditions. It's the number one most reimbursed problem and on vaccine court is the flu vaccine for causing neurological harm, folks. We know for a fact the flu vaccine can cause neurological harm. So how is it that common sense wouldn't say during the most important time of a baby's development of their central nervous system, in the womb, the first trimester, how can we say that something neurotoxic like mercury, if the woman got a mercury-containing thimerosal-containing flu vaccine, which is a multi-dose, or other adjuvants that cause neuroinflammation, these are all known facts, okay, behind the flu vaccine. How is it not common sense to say we could be harming the brains of our children? And if we find data and information that suggests that, It is happening, that is happening, that brain damage is occurring in these children. Why don't we at least play on the safe side and stop vaccinating pregnant mothers? At least from this research, we should be able to say not during the first trimester. At least, bare minimum. Play it safe. If it could be chance, it still could be that the vaccine is harming. That's a fact. Okay, I'm done. Post hoc means after. They completed their study the way they had planned. That's huge, people. To understand that they had the study planned to do this way, they found a significant correlation between the use of the flu vaccine during pregnancy in the first trimester. If they found that data to state there was a potential causal role in that, if they found that out from their study design, and then they say, before publication, we're going to do one more analysis. That's changing their study design. And I agree. They should want to try and find out why that was there. They should try and, look at all the biological evidence for why the vaccine and how it does cause neurological harm. Okay? Post hoc, so they did it afterwards. They didn't like the results, so they had to do and throw it through another comparison. Here's how they did it, adjusting for multiplicity of hypotheses tested. Using the Bonferroni correction suggests that the association could be due to chance. See, that is nothing more than science's scapegoat right there, folks. That right there is not science. That's a way in which, if they ever don't like, that's when they use this. If they ever don't like it, like the results they acquired from the data, they put it through this analysis so that they can then say it could be due to chance. Just could be. Could be. And then they can just water down, muck up the water so our physicians and the public can't see the truth for which they know the flu vaccine causes neurological harm. All right. So the unadjusted proportion of autism spectrum disorder was slightly higher throughout the follow-up among, so this is other information people should be aware of. The unadjusted portion of the autism spectrum disorder was slightly higher throughout follow-up among children of women who received the influenza vaccination during pregnancy compared to children of unvaccinated women. So, pregnant mothers that were vaccinated throughout the entire pregnancy, first, second, and third trimester, the data showed that there was an increased risk. There was more autistic children in vaccinated pregnant mothers. Now, once they did their adjustments, and that's what I always like to go into, and I haven't had the opportunity yet to see how they adjusted that to downplay that. The numbers, more women who were vaccinated gave birth to autism spectrum disorder children with that condition. That's the facts throughout the entire pregnancy. All right? After adjustment for variants, maternal influenza vaccination anytime during pregnancy was not significantly associated with autism spectrum disorder except for first trimester. After adjustment for covariants for first trimester, influenza vaccination was associated with an increased risk of autism spectrum disorders. Going on. If influenza vaccination during the first trimester of pregnancy causes autism spectrum disorders, our results suggest that there would be an amount of 4 additional autism spectrum disorder cases for every 1,000 women vaccinated. Guys, that's huge. We don't need any more children harmed. Play it safe. Please, I'm begging the medical communities out there, please listen to this. Use common sense. And bare minimum, they didn't see a risk of brain damage in children whose mothers had the influenza. For the first time in history, we've been mass vaccinating pregnant women. They've been pushing it hardcore over the last few years. And guess what? For the first time in history, we now have more babies dying before birth than ever before in history. Folks, wake up. What have we changed? What are we doing? And infant mortality rates have not gotten better. That's not what's happening. We lose more babies than any other industrialized nation on day 1 of birth. We lose more babies in the first 2 years of life than any other industrialized nation. Folks, unacceptable. Unacceptable. We have to change the system. We have to change health care and deliver health to these mothers. Stop poisoning them with things that we know causes neurological harm, for which can shut down the nervous system of a baby. I had a military member. She was forced to get the flu shot. She was pregnant, and they pushed her. They said, it could protect your baby. You got to get the flu vaccine. They gave it. 2 weeks later, after that flu vaccine, the baby was found to have no heartbeat, and the baby's life was lost. They dated it literally the day of that flu vaccine for when that baby died. I asked her, did your physician, did the medical physicians out there on post, Fort Campbell, did they report it to VAERS? She goes, what's that? VAERS is Vaccine Adverse Events Reporting System. She goes, I never heard of that. I don't think so. I'll go check. She went and checked. They played dumb. See, that ticks me off. And why am I? That was dumb of the doctors to do that. They played dumb as if they didn't know it when she pushed, oh yes, and she got it reported.
They wanted to hide it.
And that's why I got people out there, the trolls on Facebook and others saying, here's a study saying that through VAERS reports, they say that it is highly unlikely that the flu vaccine causes those problems. They use VAERS reports, for which the medical community admits the majority of doctors don't report because it's a voluntary reporting system. They say that it could be 100 times more injuries and deaths caused by vaccinations than what are reported. 100 times, folks. For which, mind you, our vaccine injury court is backed up more than 10 years because of the significant volume of people who are waiting in line to get compensated. Some people die before compensation. Do you guys get that? That should say, hey, look, we got a problem with vaccines. I'm going into more depth. This is what I want to do. Sometimes I get riled up and I want to go through multiple things. We may have to go through the opiate stuff next time, I'm thinking. We've got only 10 minutes left. Oh boy, what do I want to do? Let's go through more of this. Folks, thank you for listening out there. I'm Dr. Dale. I'm the Wild Doc. I can't thank you enough for the listeners, the folks out there supporting, praising me for delivering this information. I need support. Because it's difficult. It's difficult when you're battling and trying to destroy deception and lies. Because the liars are going to push back much harder. The devil wants to destroy those of us who will stand against evil and corruption. They'll cause your friends to no longer like you. They'll cause your doctors to kick you out of their clinic. Which, for that, I would have to say, you should leave anyways. If your doctor says it's my way or the highway, you need your vaccines or get out, well, that's not a very good doctor because, one, they can't sit down with you and educate you. If it was so good for you or your children, then why can't they just sit down and say, hey, let's look at the facts, let's look at all the research together because I love and care about you so much. I'm going to make sure you fully understand that this is going to benefit you and you can make a decision for yourself because you're an adult and you're an educated person. And you're a loving parent. So let's do that. No, it's my way or the highway. Get out if you don't vaccinate. Why do they do that? Because they don't want a percentage against them, for which then they don't get the bonuses from Blue Cross Blue Shield and other insurance agencies in the government, for which as long as the doctor has a certain percentage of their population vaccinated, then they get significant hundreds of thousands of dollars of bonuses, folks. And you can read that on Blue Cross Blue Shield's own website. Okay? Further into this information in the Journal of American Medical Association Journal of Pediatrics, November 28, 2016, stating the influenza, the flu vaccine during pregnancy increases the risk of autism. Like infection, influenza vaccinations during pregnancy have been reported to induce a transient increase in levels of number of pro-inflammatory cytokines, including interleukin-6, tumor necrosis factor, and C-reactive protein. Studies on mice found an association between high interleukin-6 levels during pregnancy and abnormal behavior of the brain structure. Guess what they do, folks, to be able to do these clinical trials? Not clinical, these lab studies on rats. How do they get the pro-inflammatory cytokines to go up? Inject chemicals called adjuvants. Vaccines contain adjuvants. So to cause the neurological harm, they inject chemicals that stimulate the immune response to promote the production of inflammatory cytokines. Wow! Isn't that amazing? So why don't we just stop injecting that CRAP into the public? Come on. Can I get an amen? I mean, it's like, what? You do studies on animals. You prove this is the mechanism. See, what's amazing about our body is when we get an infection through our mucous membranes, we have a far greater potential to control the amount of inflammatory cytokine production to be able to specifically kill the virus that we were naturally infected with, versus being injected, we can have an excessive, uncontrolled amount because now we have a toxin that is never supposed to go into our body, a chemical made by man, like aluminum salts injected into our body, or mercury, that causes neuroinflammation, causes inflammatory cytokine production through the wrong mechanism, through our body having to deal with chemicals, and it stimulates it. Guys, that's why this infection didn't do it, but the flu vaccine did cause neurological harm. Zero indicators of natural infection causing brain damage in children. Zero evidence on this study. Get that, folks. Get that. Now, am I saying that a woman through infection naturally could potentially have a child that was harmed during that? Yes, that could happen. So why don't we focus on the health things, the nutritional things, the anti-inflammatory foods, the adjustment process, for which the adjustments, chiropractic adjustments, very specifically done to the upper neck, the spinal cord, the nervous system, can be enhanced through specific alignments to boost one's immune system, to lower inflammatory cytokines. That's all been proven through the research, folks. Amazing stuff. Again, I'm the Wild Doc. If you want information, we're going to be talking about the 21st Century Cures Act the next show. We're going to be talking about the opiate epidemic, going into that in great detail, because we need the public and the people of our community and country to be aware of the corruption that has distorted and destroyed our Congress in terms of the majority of the members, because there's members that are fighting against the 21st Century Cures Act and fighting against the wrongful discrimination on supplements that can help somebody get off of opiates. We're going to be talking all about that next show, folks. I did want to wrapping up about 5 more minutes. I want to talk about Christian's comeback, not Christianity. Little boy, his name is Christian. He came in last week. His grandmother started him with care. I've talked about his testimony in the past. Talked about his testimony here recently, where he was dealing with asthma. His grandmother came in. She wanted to experience herself first to make sure that Dr. Dale was going to be able to take care of her. If I could take care of her, then she would give me the opportunity to take care of her grandchild, her son, or her grandson, Christian. So we started getting her well. She had some pain in her wrists, like carpal tunnel. She had a lot of anxiety and stress. We were able to help with all of those things by lowering stress on her spinal cord and nervous system, getting rid of her pain. She's like, it worked for me, so I brought him in. She's like, I wish I would have never waited so long. Because the first weekend, after the very first adjustment we gave to that boy, he didn't need his asthma inhalers. He was no longer sick through that week. Now, he's had that gunk that's been going around here recently. So this really bad cough. Even I got it. My kids got it. We all fought it off. We're all fine now. We're stronger now. You know, we have to see that natural infection is a way to boost resiliency. And in a recent study, they talked about UCLA. UCLA research actually showing, and these were flu vaccine and flu infection research studies showing that natural infection boosts our immune system against other viral infections, other illnesses, helps us survive things like pneumonia, strep, and other things, while the flu vaccine weakens the immune system, then puts you at greater risk of pneumonia, strep, and other bacterial and viral infections, and a greater likelihood of dying from significant flu outbreaks. You're more likely to die if you get the flu vaccine, and that's what the research says. And if you don't believe me, go back to the other shows. It's on the Wild Doc's website, thewilddoc.com. I got an entire hour show of nothing but I just read off tons and tons of research about the flu vaccine and how harmful it is. All right. So Christian comes in last week. You know, he's been under care for a couple weeks. He's needing his medications a lot less, still occasionally, and never when the grandmother has them, but at school and other places where a lot of people,
Not that they don't want the child to be well, but they don't understand the objectives we have. And at school, I'm sure there's different circumstances where they don't give the med. God forbid something did happen, they could be in trouble. But so he's getting medications quicker, where his grandma has been able to work with him nutritionally through recommendations and through getting adjusted. He doesn't need any medications. So awesome stuff. Awesome. We're strengthening this child, creating better resiliency rather than dependency in this child. All right. So he comes in. He's got this horrible cough. He's spitting up. He's coughing, can barely breathe at times. So his asthma's hitting. They went to the medical physicians because they were worried, and the medical physicians were like, "You need to take this." And she said the medical physicians they go to literally has a voicemail message that says, if you don't, it's our way or the highway. If you don't do what we tell you to, we will exclude you from our practice. We won't see you. Folks,
Crazy.
work with your patients. That's just the physician's office that I just completely disagree with. I don't kick people out if they choose to vaccinate. I don't kick people out if they choose not to do exercises to help strengthen their spine. I don't kick people out if they refuse any testing or refuse my advice. It's their life, it's their health. If they'll let me help them to some sort, maybe I can gain the trust eventually. They'll understand why I encourage them to do these other things. A couple more minutes, let me get through Christian's comeback. They're there, they're like, okay, we filled the prescriptions. They want us to take not only a rescue inhaler, but Advair, a prevention med. I immediately pulled an article, gave it to the grandmother. I said, here's the research. That was another drug brought to market fraudulently by these lying, God-forsaken people, pharmaceutical industries, this evil organization, brought to market, killed hundreds of children, okay? That drug, according to the FDA and according to the data that the pharmaceutical company withheld, increased the risk of asthma-related death. Advair and the prevention meds increase the risk of asthma-related death. What do parents want by taking medication? They don't want their children to die. How in the world can a medical physician prescribe a drug that increases the risk of death only to decrease symptoms? Why? I told him, please give him, if he's not going to the hospital, we're going to adjust him. I'll go to the hospital if he's in the hospital and adjust him. I was like, I'll adjust him today multiple times. I'll adjust him tomorrow. We'll adjust him every single day. I'm like, let me adjust him. If he gets worse, then resort to emergency medicine, steroids, and the inhaler. I said, just give it a chance. We adjusted him. He comes back in, running around the office, breathing fine, no more cough, no more gunk, spit it all out that night. After the adjustment, amazing recovery, guys. A comeback. That's what I desire for every child. Guys, Christian's comeback right there. Again, our medical system creates dependency. Meanwhile, what I do through education, through adjustments, I want to create resiliency in people, in children, so that their bodies have the potential and strength to overcome any illness. Folks, give me a call if you need my help. 931-591-2010. Like The Wild Doc on Facebook and subscribe to thewilddocs.com. Love you all. Have an amazing week.